There are many things that you can do to keep your bladder healthy. First of all, just going to the bathroom to urinate on a regular basis, at least every 2 to 3 hours during the day, is important, even if you don't really feel the urge to go. In addition, make sure you take time to relax so that you can adequately empty your bladder. For women, it's really important to sit down on the toilet seat. Hovering over the toilet does not allow your pelvic floor muscles to relax completely and can maintain urine in your bladder, which can then contribute to having to go back and go to the bathroom more frequently, or potentially contribute to getting a bladder infection because the bacteria has a chance to build up in the bladder. It's also important to avoid restricting your fluids in an attempt to minimize your bladder symptoms. When you restrict your fluids, you can get dehydrated. And older people, when they get dehydrated, are particularly prone to getting lightheaded when they go from sitting to standing or from lying to standing. And once you get lightheaded, then you oftentimes have to sit back down again. In that process, you're taking much more time to get to the bathroom than if you maintained a good state of hydration so that you didn't have to worry about getting lightheaded. In addition, when your fluids are restricted, you're much more prone to constipation.
Staying hydrated and preventing dehydration is important. However, a lot of patients come to us ingesting large quantities of fluid because they're under the assumption that drinking lots of water is important and healthy. It's actually not recommended to drink large quantities of fluid. You should really just drink when you're thirsty, and drinking water instead of coffee, tea, or soda is preferred. As far as overactive bladder, there are a lot of behavior modifications that patients can make that can help prevent urgency, frequency, and getting up at night or nocturia. Those include limiting your intake of bladder irritants like coffee, tea, soda, alcohol, anything caffeinated, anything carbonated, anything very spicy or acidic. Just by making some small changes to your diet, you can make a big difference in your urinary symptoms.
A high-fiber diet is so important to maintaining good bowel function, and constipation contributes to bladder symptoms. It's really important to do everything possible through a high-fiber diet to keep your bowels moving regularly. Something else that's really important is to not smoke. Cigarette smoking has been associated with bladder cancer, and when you smoke, your lungs are irritated, and that can cause you to cough, and the coughing can contribute to urinary incontinence. Staying active prevents weight gain and helps you maintain your overall musculoskeletal strength so that you can move quickly to the bathroom when you need to.